Let us talk about the role of angiography in a patient with lower GI bleeding. So here is an elderly gentleman who has come in with bright red blood per rectum, multiple bowel movements, and his family reports that he had a syncopal episode and also comment that he is a little bit confused and has some chest discomfort. So this is something you wonder whether the patient has a severe lower GI bleeding. And while you're talking to the patient says, I just had another bloody bowel movement, had multiple bowel movements in the last 3 to 4 hours. That indicates that the patient has ongoing GI bleeding. And in this setting, uh, patient with severe bleed, ongoing bleed, hemodynamically unstable despite the transfusions. You should consider angiography, not emergency colonoscopy. And when it comes to angiography, let us review the anatomy of the colon with a special reference to the arterial supply. The right colon is supplied by the superior mecentric artery that comes from the descending aorta. And here are the different branches that supply different sections of the right colon, starting with middle colic artery, right colic artery, ileocolic artery, and appendiceal artery. As you can see here, these branches from the superior mesenteric artery not only supply the small bowel but also supply the appendix, cecum, ascending colon, hepatic flexure, and proximal half of the transverse colon. Now let us look at inferior mesenteric artery. Inferior mesenteric artery has the following branches: the left colic artery, ascending branch, descending branch, and sigmoid branches, and superior rectal artery. So when you suspect a diverticular bleeding, you're going to focus on the inferior mesenteric artery. And if you suspect a right colonic bleeding, like say for example massive bleeding after polypectomy in the right colon, then you focus on the superior mesenteric artery. So once you decide that the patient needs interventional radiology support, and depending upon the status of the patient, the radiology team may do an emergent CT angiogram to help them navigate the vessel that they need to focus on, especially uh, if it is possible to do so. Sometimes it is not possible, and then they take them to straight angiography. And here is a femoral puncture and the catheter going into the inferior mesenteric artery because the suspicion was sigmoid diverticular bleed. And as you can hear, this is a diverticular bleed from the sigmoid, selective catheterization of the branch that was causing bleeding, and that was marked by a clip uh, on during prior failed colonoscopic intervention. And once you subselect the feeding artery to that diverticum that's bleeding, when you inject contrast, you will see a blush confirming active bleeding. And then you put in coils or thrombin or some form of embolization material to plug that bleeding vessel and stop the bleeding. Sometimes it so happens that the interventional radiologist spend a lot of time to find the bleeding vessel, and if the bleeding has stopped, the angiogram will be negative, and the patient may be coming back to the ICU without a definitive therapy, and the patient may be intermittently bleeding, and in that case, you may want to consider a red blood cell scan. And the red blood cell scan, basically you inject, you tag the red blood cells and then put them under the machine to see if the red cells extravasate. And over a period of time, in this case, there was diverticular bleeding. There was a opacification of the sigmoid area, and with time, it has increased in size, which gives a rough idea that it is probably coming from the sigmoid colon, and the radiologist could go to that site and consider uh, embolization therapy, or the surgeon may consider doing a sigmoid colectomy, depending upon what the team decides. I hope this is useful. Thank you.